Hey guys, what's up? My name's Christian. I'm a pre-PA student. I'll be applying in a few months now, about mid-April. So, I got most of my application ready. I'll be, ready to go in a few months. So, just got done with class. I had immunology, organic chemistry, and calculus. I haven't released a video in a few weeks. I want to say 2 weeks because I've just been swamped with exams that last week. So, studying the week before, taking the exams. It's a pretty hectic week. Did pretty decent on all the exams. I would have liked to get a little bit of better grade in immunology and calculus, but the first exam, you never know what to expect. So today we're going to talk about the top 5 patient care experience jobs for pre-PA majors / PA school. So how I rated these, I don't want to say they're in any so how I pick these is by quality of the experience. So how direct is the patient care, and then how easy it is to become to get into one of these positions, like as far as training goes, then the pay, and the main thing that PA schools are going to look for is how hands-on are you with the patient. So some schools even count being a lifeguard as patient care experience, but the amount of times you're actually, just as an example, the amount of times you're actually hands-on is, very slim. That's why they only take a certain amount of hours, like 50 to 100. Some schools will take, because it's not very, hands-on healthcare experience. So the number one on my list would be, it's actually like a group of jobs. So it would be a certified nursing assistant, a CNA, or a nursing assistant if you could find a job that doesn't require you to be certified. A certified medical assistant, or just a medical assistant. And then I also grouped in resident assistants and patient care technicians. So they all do kind of similar jobs. They're tending to the patients, helping them with daily activities, getting them dressed, giving them showers, feeding them, stuff like that. Basically helping them with whatever they need. So you're with the patient, almost your whole shift. So that's why I consider that number one, because the training is fairly short. I think for CNA programs you could even get in about like a 10-week program. And some places will actually pay you to go through training, especially now with the coronavirus. A lot of places are looking for nurses. Same thing with kind of medical assistants, but I would say it's a little bit easier to get into being a CNA. So that's why I would say CNA, RA, PCT, CMA, stuff like that is the number one pre-PA. And obviously, I say that it's the number one, but you have your personal preferences. Me personally, I don't want to have to be the one to shower the patient and feed the patient and all that. And I, have massive respect for the people that do that, especially at the hospital I work out. They're all amazing people. But it's great experience for PA school to be so hands-on with a patient. But it depends if it's for you or not. So it might not be number one for everybody. Might not even be an option for some people because they don't want to do it. Second, and I might have a personal bias on this, but it's also number two because it doesn't require any prior experience typically. So there's no degree, no certificate. You can just, if you have a high school diploma, you're good to do it. That would be a physical therapy aide. Now, a lot of people confuse the aide and the assistant. I am a physical therapist assistant. So I basically do whatever the therapist would do. The only things that I can't do are evaluations. So when the patient first comes into the hospital or outpatient clinic, I cannot see them and devise their treatment plan. Now in outpatient, some some therapists will have the PTA follow a strict guideline of exercises, and the PTA will take them through the exercises and do any ultrasound or massage or electrical stimulation that they have to. Some places, and especially in inpatient where I am, I'm able to do whatever I want with the patient as long as it's in the orders. So I could do whatever exercises I want with the patient. I could do balance exercises. I could walk with them. I could do whatever I want. So there's a lot more freedom with being an assistant. Now a PTA, a physical therapist aide, which requires no experience, assistant requires 2 years, which is what I did. A PT aide, some PTs will have them, or PTAs will have them do a few exercises with the patient, but they cannot do anything like electrical stimulation, ultrasound. They can help set it up, but they can't actually perform it. Massage, they can't do anything like that. And then an inpatient, where I work specifically, they do even, they have less duties than that as far as patient care goes. So at where I work, the PT aide mostly cleans up, sets things up for us, follows us with a wheelchair if we're with the patient, things like that. But it's great patient care experience nonetheless, because you're always working with patients, you're working with other healthcare providers, and the best part is the pay is decent and it doesn't require any prior schooling or experience. So that's why it's number 2. Number 3, just because of all the wide cases of things you're going to see, and it kind of really fully immerses you into the healthcare field, I think, and that would be an EMT, or emergency medicine technician, which is different from a paramedic. So a paramedic is going to have more schooling than an EMT, so, and it's going to cost you more to become one. So an EMT is typically about 120 to 150 hours of training, depending on where you work. So there is private, and there's private companies, and then there's like working for a municipality, like a city or a town or something like that. And the pay is pretty decent. I think it's around like $10 an hour or higher, and that also depends on if you work private or institution in a municipality. But the amount of cases you will see, I think, is very worth it for the amount of time. The one course I was actually looking into becoming an EMT just for some extra experience, and the one course I saw was like 3 to 6 months depending on how fast you took it. And as someone who wants to work in the ER, it's, you know, very good experience. Oh, I forgot to mention, so if you want to go to orthopedics as a PA, definitely go for PT aide. If you want to go for emergency medicine, definitely go for EMT. So try to make your patient care experience match up with your future goals, because 1, it'll be more meaningful to you, and 2, it'll look better on a resume to have that work experience when you're applying for a PA job in the specialty you want to get into. 4 is going to be an ER tech. So typically these could be a CNA or an EMT, just working in a hospital setting, like an ER setting. So it kind of ties into number 1 and number 3. But the reason that it's number 3, that it's number 4 and it's on here, is because once again, when you're in the ER, you see such a wide spectrum of different patients and different diagnoses, and you're working with such a vast number of different healthcare professionals. I mean, nurses, doctors, other PAs, NPs. I mean, the amount of experience you can get just from being an ER tech working in the ER is huge. The amount of procedures you're going to see, so that's why that's number 4. I think it's a great option. And now next is a scribe. So being a scribe is definitely a great option. Every person that I've talked to has been pre-PA or pre-med and worked as a scribe. They've all said that it was a great experience and it's great for exposure into the healthcare field. And it really helps them throughout PA school, even because you learn a lot of medical terminology, a lot of abbreviations, which in the medical field, there's really this push for, you know, to be as efficient as possible. So it's really important that you get your typing skills down and know the abbreviations that you could use and understand them when you see them in a chart. I mean, if you see CABG, are you gonna know what that is? If you see FX, are you gonna know what that is? So it's really important for you to understand those. And definitely, you could learn this from any exposure in the healthcare field, from any of the careers that we mentioned, but scribe, I would say, would definitely help you the most as far as that goes, because you're focusing on specifically terminology. Now the downside about being a scribe and why it is number 5 is because it's great for, you know, learning terminology and talking to the doctor. There's no or little, very minimal hands-on patient care. So as a scribe, you're not actually touching the patient. Some places will not even let you touch the patient. You're not allowed to do that. You're not even allowed to set up anything medically. So some schools will only take a certain amount of scribe hours. So that's another thing to keep in mind. I think some schools only take 50 to 100, like the lifeguard. So that's something to keep in mind. So now we're talking about some schooling that could be an option if you plan on applying for PA school later in life or for whatever reason. Or if you already work as one of these, they're great experiences. But they're not something that, as a pre-PA, if you're already in your bachelor's phase, you would not want to do these because you would need an additional degree. So like I said before, I'm a PTA, physical therapist assistant, which I think is a great option. You're hands-on with the patient, you're devising the patient's plan as far as treatment goes. You get exposure with, if you're in inpatient, some outpatient places do this, you get exposure with ultrasound, electrical stimulation, massage, different things like that. You see a wide spectrum of diagnoses. I primarily see orthopedic and neurological stuff, but I also see cardiac, even gastrointestinal stuff. So a very, very wide range, but it's mostly neuro and orthopedics as far as that goes. Another thing is an occupational therapist assistant. They basically do pretty much the same. It's therapy, but if you're in an outpatient, it's more so with the arms. If you're in, if you're an inpatient, it's mostly with the arms. If you're in outpatient, it's mostly work-related activities you're doing. Another option is an RN. You all know what an RN is. Great experience, but it's going to take an associate's degree at minimum, just like the PTA and OT. So if you don't have 2 years before you apply to PEA school, and also if you don't have time to work as a RN, there's really no point in doing it if you're in the bachelor's phase. Another thing is tech jobs like a lab tech, a surgical tech, and an x-ray tech. They're great options for pre-PA, but once again, if you're already in the bachelor's phase, there's no reason to go 2 years for an associate's degree and then you only have 2 more years to work. It's much better if you're already in the bachelor's phase to become a CNA, PTA, EMT, ER tech, or a scribe or something like that. And so that's all I got. I hope you guys enjoyed this video. But once again, I have these rankings, but it's definitely what's important to you personally. So that's how, in the end, that's how you should pick your patient care experience. Just keep in mind, things like the pay, the amount of schooling it's going to take, and how PA schools see it. So you definitely want to look for what is going to give you the most direct patient care experience in a field that you're highly interested in. But in the end, patient care experience is patient care experience. Just get whatever experience you could. That's even could be like volunteering or something like that. So that's all I got for today. If you guys enjoyed, hit that like button. Go ahead and subscribe to the channel. I'll be posting more pre-PA stuff, motivation, maybe a little bit of fitness and finance. That's all I got for today. Peace out, guys.